To overcome Canadian healthcare's backlogs in cancer care, delayed diagnosis that lead to poor outcomes, and increasing financial and resource constraints, we seize the opportunity to optimize colorectal cancer care pathways to improve value, thus launching the very first VBHC demonstration project of its kind in Canada. This single medical condition IPU-based initiative represents the first formal real-time effort to study and optimize the colorectal cancer care trajectory in the Canadian healthcare system. The Quebec Cancer Coalition, together with the Jewish General Hospital in Montreal, are collaborating to demonstrate the feasibility of simultaneously implementing mutually reinforcing elements of VBHC to improve health outcomes for colorectal cancer patients, optimize their care trajectory, and ensure that clinicians and managers have the necessary data to measure and improve value in a sustainable and scalable way. This initiative simultaneously implements 5 out of the 6 of Porter's value agenda: developing and organizing care into IPUs, incorporating PROMs and PREMs collection into standard outcome measurement and care delivery, building an enabling technology platform and VBHC data dashboard for tracking and sharing data on relevant clinical and patient-reported outcome indicators, integrating care across departments by mapping and optimizing the care trajectory and coordinating care teams, and expanding geographic reach by scaling the implementation framework to other cancer types and centers.
The colorectal cancer care IPU is developed to optimize CRC care delivery and thereby improve patient health outcomes as well as their care trajectory without higher costs. We map the full patient care pathways to understand the current composition of the multidisciplinary team delivering care to CRC patients. The IPU is currently being tested in the CRC surgery department and includes an important rehabilitation service element that has been developed to promote the success of surgery, reduce complications from surgery, and to ensure best recovery after surgery. With proactive interventions such as rehabilitation, nutritional and psychosocial support, we expect to see improvements in the financial, human, and material resources, lower rates of complications, and emergency room visits.
At the Jewish General Hospital, our goal is to provide patient-centered value care. We have implemented a remote electronic screening tool called the Wellness Questionnaire using the Qualtrics platform. This platform will be used to collect a common set of EPROMs, otherwise known as patient-reported outcomes, that are routinely collected and reviewed throughout the patient's colorectal cancer care trajectory. These outcomes not only have a meaningful impact on the patient's quality of life, but equally will contribute to early identification of patient needs, prioritize concerns identified by the patient, and guide coordination of care delivery by healthcare professionals, support real-time monitoring of physical symptoms and psychosocial concerns, facilitates the delivery of personalized educational materials to optimize patient self-management, and lastly, promote healthcare professionals' engagement in the integration of PROMs into their clinical practice. A summary report is generated after completion of the questionnaire. If urgent, a nurse will follow up 24 to 48 hours. Non-urgent matters are reviewed and the nurse will contact the patient within a week. In summary, all interventions provided are based on patients' needs, preferences, while maintaining patient safety.
We are very excited here at the Jewish General Hospital to be creating a new electronic data platform to evaluate value-based healthcare. This will allow us to systematically collect and track important clinical outcomes, whether it's PROMs or PREMs or healthcare costs. And this will be a real-time dashboard meant to improve in real-time decision-making between the CRC IPU and the Quality Improvement Department. Obviously, it's not just meant as a data collection method, but we do expect this dashboard to really improve our patient care, whether it's survival, quality of life, as well as better and more accurate assessment of symptoms and side effects of treatment. Obviously, this, we hope, will ultimately lead to lower rates of complications, emergency room visits, more streamlined and useful outpatient visits, as well as in the long term decreasing side effects by proactive nursing care based on these PROMs and PREMs. As a parallel measurement, we will be looking at costs, whether it's in the implementation of this trajectory of care, but as well in terms of optimizing limited resources. And these could be financial, human, or material. And ultimately, what we are trying to do is to improve patient care.